Hello and welcome everyone to the second session of this year's Pediatric MCQ series. It is for 2026, and today's topic is on developmental milestones. As I have already mentioned yesterday, that we are going to cover important topics of pediatrics, and those topics and MCQs will be useful for NEETPG, FMGE, and PDCET exam aspirants. So you can subscribe our channel Shishu Care for more such videos on regular basis. We will try to upload these videos. So let's start with today's MCQs. So first one, a term infant who does not show social smile. So there is no social smile by 10 weeks of age. No social smile by 10 weeks, that is 2.5 months of age, should be evaluated for normal variation, autism spectrum disorder, visual impairment, or hearing impairment. So you get a child who is of 10 weeks of age and his parents complains, or either as a pediatrician you notice that he doesn't have social smile at this age, then what you will suspect, or this patient should be evaluated for which of the following condition. So answer for this is visual impairment. Okay, no social smile. If a child presents with no social smile at 10 weeks of age, then first we should evaluate for visual impairment, because the child is unable to see the faces properly and hence he is not able to reciprocate with social smile. So what things are required for development of a proper social smile at the mentioned age, that is the appropriate age for that particular milestone? So first is visual fixation, intact visual pathways, and social responsiveness. So at this age, absence of social smile is not autism. Keep in mind, ASD, because autism spectrum disorder manifests later. It's not a disease which gets manifested at 6 to 8 weeks. So hearing impairment affects language milestones and not social smile. Hence, vision must be evaluated first. So vision is important in this case. That patient might have congenital cataract or retinopathy or any severe refractory error. So for exam point of view, no social smile at 2 months, think vision first and not autism. All right. So second question is persistence of head lag beyond 4 months. Head lag, no neck holding till 4 months is most strongly indicates abnormality in social development, language, gross motor, or fine motor. This is very easy. This is gross motor delay. Head lag or neck holding is a gross motor milestone. So if it get delayed, then this is gross motor development. Now the points to be noted that head control depends on neck extensor strength and truncal tone. These two are the factors on which head control depends. And normally partial control is by 3 months of age and no head lag after 4 months of age. Persistent, if the head lag is persistent, then it suggests either hypotonia or cerebral palsy or any neuromuscular disorder. So no neck holding till 4 months of age, you should check for hypotonia or cerebral palsy or any neuromuscular disorder. Now in NEET SS exam, head lag is not equal to language or social delay. So if the patient is having head lag, it doesn't mean that he might also have language or social delay. Okay, so this point to be keep in mind for MCQs. Now an infant with canonical babbling, this is Baba sound, but absent response to name should first be evaluated for. So infant has developed babbling, he babbles but absent response to name. If you take his or her name, that particular child doesn't respond, so this patient should be evaluated for autism spectrum, hearing loss, global developmental delay, or expressive language delay. So such patient should be evaluated for hearing loss. That babbling is present but the patient is not responding to name, so hearing loss should be evaluated in that case. Now babbling, what babbling indicates? Intact motor speech apparatus, so there is no speech issue. Failure to respond to sound or name indicates auditory pathway problem. Autism typically presents later. So for autism, in all the question, this is the point that it presents later. And the symptoms or features of autism, there are many features, but mostly poor eye contact or absent joint attention. So therefore, hearing assessment or BERA is the initial step which is to be taken if a patient is not responding to name. Now, which milestone best reflects cortical maturation? Cortical maturation is reflected by which milestone? Social smile, sitting with support, C. pincer grasp, or D. stranger anxiety. So cortical maturation, pincer grasp reflects cortical maturation in the best possible way. So if question comes which milestone reflects cortical maturation, then pincer grasp is the answer for that one. So now, what are the requirements for a proper pincer grasp? Fine motor control should be there, and a cortical integration of parietal lobe involvement is there, so cortical integration should be there. Gross motor milestones can occur with subcortical control also, and hence pincer grasp is most sensitive cortical marker. So pincer grasp is most sensitive cortical marker. So this can be a good MCQ even for NEET SS exam, that uh, which milestone reflects cortical maturation. So pincer grasp should be answered in this case. Now a child who can sit without support, has a mature pincer grasp and waves bye-bye is most likely aged. So what are the milestones this child has achieved? Can sit without support, has immature in pincer grasp, okay, not mature, and waves bye-bye is most likely. So the age is most likely 9 months, because sitting without support at 9 months, immature pincer also develops at 9 months, and gestural communication, that is waving bye-bye, by 9 months. So simple question. Now which milestone is the widest normal age variation? So what does this statement mean? Let's suppose particular milestone is to be attained by 6 months of age, and we say that the range is 6 to 8 months, but which has the widest? Like for 6 to 12, it is 6 months variation can be there, and that is also if someone is one baby is attaining the milestone at 6 months, another baby is attaining as 12, but then too we are considering this as normal physiological variation. So which of the following milestone has this maximum physiological or widest normal age variation? It is social smile, sitting, walking, or speech onset. So walking has widest normal age variation, and practically also in routine life we have seen that some child starts walking at a particular age as defined by the normal milestone development age, but sometimes even if there is a little bit delay in walking, then too it doesn't suggest any major developmental delay. So normal walking range is 9 to 18 months. This is a wide range, as I've explained. The range is here 9 to 18, so almost 9 months of age difference can be there for development of this milestone. Now social smile and sitting have narrow windows, and hence walking causes maximum parental anxiety but wide normality. So many time in OPD, parents presents that my child is still unable to walk and my neighbor's child has started walking. बट ऐसा ज़रूरी नहीं है कि हर बच्चा 9 से 10 महीने या 1 साल में चले. 9 to 18 months, even if this much variation, then too it is considered as normal, physiological. So a child with good eye contact, this is another MCQ, question number 7. A child with good eye contact, pointing and gestures but no words at 18 months, most likely has. Now what things are there? Eye contact is good, pointing and gestures, but no words at 18 months. Words production is not there at 18 months, so this child is most likely having isolated expressive language delay, because autism usually eye contact is not there. So isolated expressive language delay, because what is preserved? Social reciprocity, non-verbal communication is preserved. How social reciprocity is giving gestures, he's pointing to the things, so non-verbal contact is there, but this word production is not there, and autism is also ruled out, and language delay is isolated, so it usually have benign prognosis. This is also to be remembered, and that if only isolated language delay is there, then the prognosis is good. Now next question, loss of previously acquired milestones is termed as. Now suppose a child is developed to walk without support, and then after few months the parents comes to the pediatric OPD with complaint of that now my child is unable to walk. So what is this term? Is very easy question. Developmental delay, arrest, regression, or variation. So everyone is knowing this answer. I know that this is developmental regression. Regression means once you have attained that particular thing, and now it's again going in the reverse direction. So regression, R for regression and R for reverse. So this thing we should keep in mind. Now regression is loss of skills, and it strongly suggests neurodegenerative disorder, metabolic encephalopathy, or autism, that is language and social regression. So if a child comes to you with milestone regression, then you should evaluate that child thoroughly. So remember this thing, regression is never normal. Okay, parallel play is normally seen at. Now this is a good term, parallel play. And at what age it is seen? It is seen at 2 years of age. Now let's go through something about these. There are three terms, particularly parallel play, associative play, and cooperative play. Okay, so what is parallel play? A child plays beside other children without interacting with them. So they are playing with other children, but there is no interaction. So no interaction is there. They are just playing. This is parallel. Like one child is playing here, one child is playing here, but they are not interacting with each other. Okay, this is parallel play. Now what is and it is achieved at 2 years of age. Now what is associative play? Children interact and share toys, but no organized goal. So they are not playing with any particular organized goal. No organized behavior is there. They are interacting with each other and sharing the toys, but no organized goal is there. Okay, like they might have a cricket bat and a ball with them, and they might share to each other, but they are not playing properly. They are not playing that particular game of cricket properly, that someone is bowling and another one is batting. Okay, so that is associative play. It is usually achieved at 3 years of age. And the third one, the more advanced one, is cooperative play. That is, children play together with a common goal and organized roles. So what are the organized roles? Like one is doing batting and other is doing bowling. So this is the organized way of playing. This is achieved at 4 years. So 3, parallel play, associative play, and cooperative play. And also remember the age at which this is achieved. Okay, so going to the next question. Failure to speak 2-word meaningful phrases by which age is a red flag. So if a child presents and to you in OPD and his parents complain that he is unable to speak two meaningful words in a phrase, then at what age this developmental delay or this delay in milestones is considered as a red flag? So at 2 years of age. So 2 for 2. If 2 years of age and the child is unable to speak 2 meaningful words, then this is the red flag. 2-word phrases is expected by 24 months, or it's easy to remember 2 words and 2 years. Absence should be valid for hearing, ASD, that is autism spectrum disorder, and cognition. Next question, which developmental domain is most sensitive to environmental stimulation? Most sensitive to environmental stimulation, that is the environment surrounding that particular child. So gross motor, fine motor, language, or social. Language is very much sensitive to environmental stimulation, like in which type of environment that particular child is living in. He usually develops that language and that sort of milestone of that particular language. Okay, so now a child who runs, so what are the milestones he's achieved? He's running, he's building a tower of 3 cubes, and he has 10 to 20 words of vocabulary. So this is achieved at 12, 15, 18, or 24 months. So this is usually achieved at 18 months. He's running, tower of 3 cubes, and 10 to 20 words. So tower of 3 cubes usually we remember 18 months. Which is the earliest social milestone? Again, good question. Earliest social milestone: social smile, stranger anxiety, regards face, and imitative play. So regards face. Okay, don't directly tick social smile seeing as the first option. The earliest social milestone is regards face. So regards face. Okay, now copying a circle is achieved at, a child can copy a circle, and this milestone is achieved at how much age? It is 3 years. So a circle is drawn by a child at 3 years of age. Copying a cross. Okay, cross is achieved at what age? So cross is achieved at 4 years. So circle at 3 years and cross at 4 years. This. Now, which milestone is most affected in chronic malnutrition? If a patient is chronic malnourished, then which milestone is affected? Language, social, gross motor, or vision? So gross motor is affected in chronic malnourished children. Okay. Now, which milestone best reflects visual-motor coordination? Visual motor coordination is reflected by which milestone? Social smile, tower building, babbling, stranger anxiety. Now, before moving to the answer, just go through these options. Social smile, there is the role of vision, but no motor coordination is required as such. And babbling, a child can babble even without visual stimulus. And stranger's anxiety, visual but not actually any motor coordination. Those are the emotional or gesture sort of things. So tower building, it requires, because you are seeing like one tower is already built, or is there, then there is an image of a particular tower and the child imitates and try to make that tower. So he's seeing this with his or her eyes, and then he is trying to use his motor skills to make that tower. So tower building is this milestone reflects visual motor coordination at its best. Now next, in preterm infants, we are talking about preterms. Milestone should be assessed using chronological age, gestational age, corrected age, or birth age. So corrected age, very easy answer. Every one of you know. So preterm, corrected age. Okay. Now question number 19. A child with normal motor milestones but poor eye contact and absent joint attention most likely has. So what are the things? Motor milestone is normal, poor eye contact is there, and absent joint attention is there. The attention is not good. He is unable to maintain attention for long period of time. So hearing loss, expressive language delay, autism spectrum disorder, intellectual disability. So finally, after doing many questions, the answer of this one is autism spectrum disorder. And you all know this very well, that motor milestones are always normal, but the eye contact is poor and there is absent or lack of joint attention. So A is D's answer in this case. Question number 20. Which statement about developmental milestone is true? So first is all milestones occurs at fixed stages. Regression is normal. Sequence of milestones is predictable, and language precedes social development. So sequence of milestone is predictable. This is true. Otherwise, all milestones occur at fixed stage. No, we know there are variations. Regression is never normal. Always remember this, even in your clinical practice, that regression is never normal. Whenever you see a child with developmental regression, you should evaluate that child thoroughly. Language precedes social development. This is also wrong. So the answer is sequence of milestones is predictable. So these were the 20 MCQs from developmental anomalies, we can say, or developmental milestones. So thanks for your patient listening, and you can subscribe this channel for more videos. We will try to upload at least 20 questions video with 20 questions daily with a new topic, and you can give your suggestions in the comment box, that if you want me to change something or improve something or include something in my videos. Okay, so thank you very much and all the best.